Community Hospital, and the supervisor. I think we had about 800 people on the campus for that event. But I do appreciate your being here today because this is a very special event, and I'm delighted to have a chance to welcome you to the symposium. I'm recognizing that this is the 10th year, the 10th anniversary of the symposium. I just want to congratulate Dr. Friedman for his leadership in getting us to the 10th year point. I know you all are the experts in this, but clearly the reason we're having this symposium is because of how important and critical this issue of drug abuse and addiction and related issues, including the sort of biomedical issues associated with it, how important these issues are for this community in South Los Angeles. I don't how many of you were in South LA in the 1980s? I think that was kind of a real one of those nadir periods because of the crack cocaine epidemic. And I think anybody who was in Los Angeles in the 1980s could not help but notice the depth of the impact of drug addiction and abuse on all the communities of Los Angeles. That, of course, led to a related situation with incarceration. That is another issue related to drug abuse and addiction. These are clearly public health issues, and they're community structural issues, which also become public health issues. And in South Los Angeles, those issues are as critical as they are, I think, in any community that we could find and talk about in the United States. But you all are here because you're the experts, and I'm not an expert in this area myself. I'm simply, a doctor, a general internist, but I've taken care of patients who have been battling these afflictions in a variety of ways. I remember taking care of a patient one time in general internal medicine clinic, seeing him for the first time, became a long-standing patient, a UCLA employee, and I discovered that he was a methadone maintenance patient. And I shouldn't say patient, he was a methadone maintenance person, and was very successful in his career at UCLA, despite having to depend on methadone to break the scourge of opiate addiction, and had done so successfully. And I think when I think about that patient, I think of how there's actually a real possibility for bending the curve of drug addiction and abuse. And again, whether we're talking socially, psychologically, biomedically, there's potential out there for great improvements, and I think you all represent the cutting edge of that potential. So again, welcome to the 10th symposium. And again, Dr. Friedman, thank you for bringing these symposia to our campus. We appreciate the opportunity to host this symposium year after year, and we appreciate your being here to share this occasion with our university. So thank you all very much.
Thank you, Dr. Kyle. Very inspirational work. We appreciate the university and your support, and we'll see you next year. And is there going to be conflicts in August 2016 with the 50th year anniversary that we're going to have to work around, or?
No doubt.
Okay. We look forward to the conflicts.
For those of you who haven't heard, next year is our golden anniversary for this university. Many people don't realize that Charles R. University of Medicine and Science is, as we speak, 49 years old, and we are approaching our 50th anniversary next year. That's a very auspicious occasion, and I think it would actually be fitting to think about how we can articulate this symposium with those 50th anniversary events, because it is actually so relevant to the mission of this university. So I think that would be very fitting.
Beautiful. Thank you again, Dr. Carlisle. Okay, so we start our afternoon session with a presentation by Andrea Hardin, chronic nicotine exposure during adolescence alters the rewarding properties of cannabinoid agonist CP 55941 in young adult male rats. Thank you, Andrea, for coming from San Bernardino.
Hi, as you mentioned, my name is Andrea. I'm from Cal State San Bernardino. So the background of this particular study is that each day over 1,000 people under the age of 18 become daily cigarette smokers. This is interesting data because.